Now we move to Lecture 3B, Cross-Cultural Mental Health Part 1, Indigenous Mental Health. Before I start, I would like to acknowledge the traditional owners of the land on which we meet today, even through online. I would also like to pay my respects to elders past, present, and emerging. Today's lecture based on the reading by Professor Guba and Collis, published in 2020, a scoping review about social and emotional well-being programs and services targeting Aboriginal and Torres Strait Islander young people in Australia. Understanding the principle guiding promising practice. Through today's lecture, we will understand a little bit better about the principle that we used to guide the practice working with Indigenous youth in Australia. In this lecture, I will cover the background of the study and also talk about the methods of scoping review a little bit, and also the results, alignments with the SEWB principles we discussed in the previous lectures, and also a couple of take-home messages. As we have discussed in the previous lecture, the effective mental health support, mental health care for Aboriginal and Torres Strait Islander populations must be embedded within the context of cultural understanding and knowledge, the historical and political context, background of colonization. A key aspect of this cultural understanding and political and historical understanding is a framework of mental health within a broader conceptualization of social and emotional well-being, SEWB. When we look at the diagram on the left-hand side, if we remember, there are 7 domains of this SEWB model: connection to countries, connection to culture, connection to community, to family and kinship, connection to mind and emotions, connection to body, and connection to spirit, and spirituality and ancestor. And within the 7 domains, at the core is the self. And these 7 domains and the self are determined by political, social, and historical determinants. So this is the model of social and emotional well-being. In the SEWB framework, there are 9 guiding principles. Health is a holistic concept. Second, the right to self-determination. Third, the need for cultural understanding. The fourth, the impact of history in trauma and loss caused by colonization. The fifth, recognition of human rights. The sixth, the impact of racism and stigma. The seventh, the recognition of the centrality of kinship. Kinship and family is important for Indigenous Australians. The 8th principle is the recognition of individual and community cultural diversities. Even though we look at the collectiveness, for example, community, kinship, family, but we also need to recognize the individual and community cultural diversity. The 9th principle is the recognition of Aboriginal strength. We will go through the principles one by one later on. What are the results we would like to see under the SEWB framework? We would like to see social justice and across government approaches, which means it's the whole social justice and the whole government approach, not only one government department, one government agency, but the whole system. We also would like to see the implementation of population health approach. So this subject, population mental health, is very much allied with the population health approach. And also, we would like to see the SEWB framework to be implemented in the service, access, and appropriateness, guiding the design of service, and also workforce in health and mental health, in healthcare and mental health care, and of course, quality improvement in mental health care services and also healthcare, primary healthcare services, and also hospital, and all the entire healthcare system. And what are the actions that need to be taken, including the following areas: capacity building for workforce and also for Indigenous people, and working together all over the countries, working together, and access to the service and information. This is the action area need to be improved. And workforce development, particularly investment to enhance the workforce of Indigenous practitioners, healthcare workers. These are the action areas we should target. What are the strategy areas for the SEWB framework? Focusing on prevention, and this is important. With the prevention, intervention can be taken before problem become a big problem. And also effective law enforcement approach and effective treatment and support services, strategic coordination, and capacity building. Capacity building is always the key to improve social and emotional well-being. The aim for this particular research project is to adopt a strengths-based approach and consider the importance of implementing the principle of SEWB, the 9 principles we discussed previously, in service designs, and also to analyze whether the service designs align with the guiding principles of SEWB. And second, to identify key strategies adopted by programs, the existing programs and services that adhere to the SEWB framework, emphasizing social and emotional well-being among young Aboriginal people and Torres Strait Islanders, with a specific emphasis on programs and services addressing severe and complex mental health issues. So using a scoping review to see the evidence in the literature. This is the aim of the research. Using a strengths-based approach is one of the focus of this research project. So let's take a few moments to have a revision on strengths-based approach to Aboriginal and Torres Strait Islander social and emotional well-being. That's from our last lecture. What are the strengths-based approach? Including listen respectfully to the person, use effective communication, apply a human rights-based approach, building genuine relationship, critically reflect on Australians' political, historical, and social context, particularly related to colonization. Evaluate the processes and outcomes. So these are the principles of the strengths-based approach that is employed in Professor Cooper's research project. I now briefly discuss the method scoping review. As we can see, this is the flow of the research process. And first, for scoping review, what are the differences between scoping review and literature review we have been doing in our undergraduate degrees. I think the biggest difference is scoping review is a systematic review. It's not just like search a couple of papers and then analyze a couple of papers. And first, I need to identify the search strategy. What are the keywords to be included in the search? And also, what are the inclusion criteria? What are the exclusion criteria? Based on this search database, for example, for this project, the author search 8 databases, including PubMed, Informed Indigenous Study Database, Web of Science, ProQuest, Scopus, Medline, Health InfoNet, and PsycInfo. The 8 databases. There are 2 databases particularly related to Indigenous study. One is the Informed Indigenous Study Database, another is the Health InfoNet. And after the database search, items would be generated according to the search terms. For example, for this study, there were 692 articles related to the search, and also they did the great literature search, including non-published paper or reports, for example, government reports, and thesis as well, and also unpublished research projects as well. And also after that, they look at, they exclude the duplicates and remove the studies that did not meet the criteria, the number 155. So after minus the 655, they have 71 articles, and retrieve from, including another 10 from manual reference search as well. The final included studies in the review, the final number was 26. So this is the process for scoping review. It's different from the literature review. We call it narrative review because the scope is much broader, and also the search process is very systematic. Before we move to presenting the results of the study, let's recap the research aims. First, to review the alignment to the 9 guiding principles to discuss the extent to which these programs and 26 programs and services align with the SEWB framework. Second, to identify gaps in the literature in relation to culturally sensitive programs and services targeting this specific population, youth of Aboriginal and Torres Strait Islanders. For this particular lecture, I focus on the result of the alignments with the 9 principles of SEWB, and which is the first research question. If you want to know more about this project, about this research, please go to read the published paper. The first principle, health as holistic. Aboriginal and Torres Strait Islander health is viewed in a holistic context, that including mental health and physical, cultural, and spiritual health. It's not only mental health, but also cultural and spiritual health as well. And within this framework, land is central to well-being. For example, in Western well-being or mental health framework, land is not part of mental health. But for SEWB framework, for Aboriginal and Torres Strait Islanders, land is central to well-being. The connection to the land is central to their well-being and mental health. Moreover, health and well-being must be understood that if the harmony of these interrelations is disrupted, Aboriginal and Torres Strait Islander ill health will persist. So to heal or to maintain well-being, harmony of this, for example, the 7 domains is essential. If there is no harmony among those 7 domains in the SEWB framework, there is no mental health and well-being for Aboriginal and Torres Strait Islander peoples. This is the first principle. The authors also look into the details of the included studies to see how the studies were aligned with the first principle, that is health as holistic. And they found many included studies value the influence of holistic interventions on SEWB among Aboriginal and Torres Strait Islander peoples. Also, the included studies strongly advocated for SEWB programs that were informed by Aboriginal perspectives rather than westernized by medical models. Moreover, for the programs to be effective, the included studies highlighted the need for Aboriginal ownership and leadership to be reflected throughout the design, implementation, and evaluation phases, and for the use of culturally sensitive screening and assessment instrument. This is very important for us as psychological trainees. We use lots of assessments and also screening. For example, in my subject, personality psychology, we introduce lots of personality tools and assessment instruments, but they were all developed by Western scholars, Western researchers. So whether they are appropriate, whether they are culturally sensitive to indigenous peoples remains unclear, or according to research, the majority of them may not be appropriate and culturally sensitive to Aboriginal and Torres Strait Islanders. So this is what we need to be aware, that the westernized biomedical models is not appropriate, is not culturally sensitive to Aboriginal and Torres Strait Islander peoples. The second principle, the right to self-determination, and the authors found self-determination is central to the provision of Aboriginal and Torres Strait Islander health services, with a focus on community functioning. Community functioning, again, community mental health, population mental health, collective self-determination, and cultural continuity. So the right to self-determination is an essential element of the services and programs to Aboriginal and Torres Strait Islander youth in the mental health service system. However, among the 26 including studies, this principle was only partially embedded in the programs of the 26 studies. This principle was more commonly discussed in the theoretical studies focusing on framework. So in the studies focusing on the theoretical framework, this principle was emphasized. But for other studies, for example, focusing on the effectiveness, the efficacy, and feasibility of the program, this principle was not mentioned in many of those studies. So this is the area to be improved in the future studies. The third principle, the need for cultural understanding. Culturally valid understanding must shape the provision of services and programs, and must guide assessment, care, healthcare, and management of Aboriginal and Torres Strait Islander people's health problems generally, and also mental health problems in particular. So cultural understanding is the core for the development, provision, and assessment of services and programs for Aboriginal and Torres Strait Islander peoples. This is one of the most important elements in the SEWB framework as well. And the authors found that among the 26 included studies, the need for cultural understanding surfaced across all 26 studies, but it was discussed in different ways. It's understandable because the focus of every research study, every publication is different. So the discussion including the application of culturally sensitive screening, the assessment and assessment instruments, and also the employment of Aboriginal trainers and staff. So there are two important things were discussed in the included studies. One is screening and assessment instrument, the scales, the tools used for mental health screening. And also, during the implementation and also design implementation assessments process, the employment of Aboriginal trainers and staff members are very, very important because they can provide culturally valid insights into the research design, implementation, and assessments. The number 4 principle, the impact of history in trauma and loss. From the review of the 26 included studies, the authors suggest it must be recognized that the experiences of trauma and loss present since European invasion are a direct outcome of the disruption to cultural well-being and cultural continuity. Trauma and loss of this magnitude continue to have intergeneration effects. It did not stop. It does not stop for one generation. It still have continuous impact on generations, multiple generations. So we must acknowledge this. Effective work with Aboriginal clients, therefore, needs to acknowledge trauma, the intergenerational traumas caused by colonization. And this knowledge needs to be conducted within a culturally safe environment and in a culturally competent and trauma-informed manner. So this is why if we relate it to the previous principle 3, that employment of Aboriginal staff members or advisors, elders are very, very important. Number 5 principle, recognition of human rights. This study found that human rights of Aboriginal and Torres Strait Islander peoples must be recognized and respected in the design, implementation, and assessment of the mental health services and program. Failure to respect these human rights continuous disruption to mental health and well-being as against mental ill health. Moreover, human rights relevant to mental illness must be specifically addressed. And also recognition of human rights as a basic guiding principle in SEWB services and programs was only partially evidenced in the included studies. For example, among the 26 studies, not every studies recognize human rights is one of the basic elements for the SEWB framework. So this is an area to be improved in future studies and also in the delivery of mental health care for Aboriginal and Torres Strait Islander peoples. Principle 6, the impact of racism and stigma. Historically, Indigenous Australians suffered racism and also still are suffering racist against them. As such, racism, stigma, environmental adversity, and social disadvantage constitute ongoing stressors for Aboriginal and Torres Strait Islander peoples, and this have great negative impacts on their mental health and well-being. So we need to understand accessing mental health services is a stigmatizing practice for many Aboriginal peoples. For them, going to a mental health service is a stigma. It's a stigmatizing practice. So that's why many of them don't access mental health care or mental health services. And the intersection between racism and stigma is also perceived as one of the main barriers in discussing problems with family and all the community. Racism and stigma, these are two adversities and social disadvantage for Indigenous Australians. And the intersection of racism and stigma is much, much bigger than only racism or only stigma. So this is one of the main barriers when discussing problems with families and community for Aboriginal and Torres Strait Islander peoples. This is something we need to recognize as well. Principle 7, the recognition of the centrality of kinship. Family kinship is central for Aboriginal and Torres Strait Islander families. So we need to recognize this, the centrality of Aboriginal and Torres Strait Islander family and kinship. This is the important elements for Indigenous Australians. The broader concepts of family and the bonds of reciprocal affection, responsibility, and sharing must also be recognized. And sharing with the community, sharing with people surrounding them, and the family, not only in immediate family, but also the extended family as well. And kinship and extended Aboriginal family systems were acknowledged in some included studies. Not all 26 studies acknowledge kinship and the centrality of family as well. So this is another area can be improved in the service design as well as the delivery and future studies. Principle 8, recognition of cultural diversity. This is very unique for Australia compared to, for example, New Zealand, because in New Zealand there is the indigenous peoples are Maori, so speak the same language, but for Indigenous Australians, there is no single Aboriginal and Torres Strait Islander culture or group, but numerous groupings, languages, kinships, and tribes, as well as way of living. So if you remember, I emphasized that we use Aboriginal and Torres Strait Islander peoples rather than people to indicate, it's an indicator that Aboriginal and Torres Strait Islander peoples are different, are diverse, and they may currently live in urban, rural, and remote settings in urbanized, traditional, or other lifestyles and frequently move between these ways of living. So it's not the fixed living style, but move around and urbanized, traditional, and other lifestyles. So we need to be aware of this diversity. As well, cultural diversity was only discussed in the included studies focusing on SEWB framework. Among the 26 studies, some studies focus on SEWB framework. For those studies, they discuss cultural diversities within the Aboriginal and Torres Strait Islander communities. But for others, focus more on implementation of the program or evaluating the feasibility, efficacy of the programs, then cultural diversity was not mentioned, was not discussed in those studies. Principle 9, recognition of Aboriginal strength. This is also a very important principle. So for us, if we work with Aboriginal clients, we must recognize that Aboriginal and Torres Strait Islander peoples have great strengths, creativity, and endurance, and a very deep understanding of the relationship between human beings and their environment. For example, I participated in Indigenous mindfulness training, Waiapa, the Earth mindfulness training. And for mindfulness for Indigenous Australia, it's related to the land, water, and sky, lighting, wind, kangaroo, and also fish and community kinship as well. So this is their understanding of mindfulness, the connection with the land, the connection with the culture, the connection with the community, and the connection between body, mind, and the environment, the nature. As such, enhance the confidence, self-esteem, and the sense of belonging were discussed positively in some included studies. In these included studies, the outcome from participation in cultural appropriate SEWB programs and services were the programs addressing Aboriginal strength. So this is the confidence, self-esteem, and sense of belongings are all the Aboriginal strengths, including the relationship between human being and their environments and the nature, the Mother Earth as well. So these are the 9 principles for the design and implementation of mental health services for Aboriginal and Torres Strait Islanders, which are aligned with the principles of SEWB and also aligned with the 7 domains of SEWB framework. Well, it comes to the end of this lecture. I would like to give you a couple of take-home messages. Although there is a clear evidence about the disproportionate burden of mental health concerns experienced among Aboriginal young peoples, evidence about the effectiveness of current SEWB programs and services targeting Aboriginal and Torres Strait Islander young peoples is still limited. Very little is known about the ideal pathway for the treatment of Aboriginal and Torres Strait Islander young people with severe and complex mental health needs. Furthermore, innovative and culturally informed approaches to the design of SEWB services and programs complemented by participatory action research and developmental evaluation approaches, will help to build the necessary evidence base to improve SEWB health outcomes among Aboriginal and Torres Strait Islander young peoples in Australia. Well, thank you so much for listening to my lectures. If you want to watch my lectures on YouTube, please follow my YouTube channel, Wendy Lee Beyond the Classroom, Open Teaching and Learning. Thank you so much. If you have any questions, please email me as well. Thank you.